question. What do you say to patients who are worried that their brow lift will pull their eyes up too much?
So I just got this question recently, and I think some of this is based on some of the photos I posted recently of foxy surgery or a really dramatic brow lift. And what I think it's important for patients to understand is that there's really two types of brow lifts that I do. So one is for rejuvenation. And so this is a patient, maybe 40s, 50s, an older patient who has lost some brow tone. The brows started to droop with time. This patient wants to go back to where they were maybe 20 years ago. So in this case, I am taking the brow as it is now and just trying to restore it to a nice, natural looking position, how it looked probably 20, 30 years ago. So that's a restoration. The second kind of surgery is what people call foxy surgery or cat eye surgery. And in this case, I'm taking usually a younger patient, maybe in their 20s or early 30s, who their brow isn't drooping. They just want it pulled more. And so these patients, I do a little wider elevation and I am trying to put their brow in a new position. So I'm not trying to put it back from a 29-year-old to where they were in their early 20s. I'm trying to make it look different. And these are the ones that we don't want to look crazy, but they're not going for a natural look. They want to have a dramatic slanted up look. And so which one goes for which patient really just depends on how they come to me. So a patient who just wants a refresh, a rejuvenation, looking natural, I try to just restore what has been lost with time. Whereas someone who wants a really dramatic, slanted cat eye look, I am trying to create a new brow for them. So don't worry, we talk about this before the consultation. And so for a patient who wants a rejuvenation, you're not gonna end up with a super slanted cat eye. If that's what you want, that's also what I can do.